Every week, Saira Akhtar visits some of the immunization clinics
You see right now over there.
where her team are setting in motion a pneumonia project which has the potential to save thousands of lives. By conducting a vaccine trial of the pneumococcal vaccine, they're hoping to influence the government to introduce it into their National Expanded Program of Immunization, or EPI as it's known as.
It's really important to help generate data that shortens the time frame between when new good vaccines are available in developed countries and when they're made available in countries like ours. So as an example, it took over 15 years for the hepatitis B vaccine from the time it was readily available in North America for it to be then introduced into many other developing countries. And what we don't want is the same experience to be repeated again and again for these new vaccines, because that essentially means that you're saving lives. And for that, you need to do these vaccine trials. And so our electronic data capture systems help in that way as well. They actually facilitate the rapid collection of information, making it available to you to move further up the chain to policymakers faster than traditional paper-based systems.
Vaccines that can prevent some strains of pneumonia, such as the HIV vaccine, have in fact been introduced into the government's immunization schedule. But newer vaccines, like the pneumococcal vaccine, which targets a different strain of pneumonia and has the potential of alleviating much of the problem, is still conspicuously missing from the government's immunization schedule.
So in Karachi, for the last 4 years, what our team has been doing is establishing field sites in preparation for these vaccine trials. The preparations include getting baseline data on what types of pneumonia are occurring in young children, and then if it's bacterial pneumonia, what proportion of that pneumonia can actually be prevented by the introduction of this vaccine. Very often you have no medical record systems in the very communities and populations that you want to work in. And it's really has been the biggest challenge for us to establish this kind of surveillance in Karachi. And we've come up with an electronic surveillance system. It's called Interactive Alerts for Childhood Pneumonia. It really provides us, through the use of cell phones and special radio frequency tags that we give to each mother and the child, it really provides us the ability to track children from birth till 24 months of age and to see how many of them get pneumonia.
The way that the project works is by enrolling children who come in for free routine vaccinations to government EPI clinics like this one here. After they've been enrolled, the project then tracks them through a network of GP clinics to see how many of them will develop pneumonia. And if they do develop it, then what kind of pneumonia it is.
This is an RFID tag. So the RFID tag basically has a unique ID of the child. And what that gives us is the ability to track the child at different places. So if this child with this RFID tag shows up at different locations where our surveillance is occurring, we can pull out other information we've collected at those centers of that child. So we collect information about previous disease.
The specific technology being used in this setting has earned the team special praise, so much so that it's being exhibited in the Smithsonian Museum in the USA next year.
Interactive Alerts system for early childhood pneumonia uses a special kind of phone, a phone that has a radio frequency ID or an RFID reader built into it. So this Nokia phone is able to tap a tag or a card and capture information by just being in near proximity to it.
These phones have been provided to 20 GPs, and all children who are enrolled into the project are requested to seek consultations with these GPs should they fall ill. So when a child goes to one of these GPs, his tag is scanned by a cell phone, which electronically transmits information to the pneumonia team in the hospital.
And once he sends the alert, essentially if a child has pneumonia, our mobile team, which comprises of a phlebotomist, comes to the GP clinic and then they take them back to the hospital for a blood culture and an X-ray.
We designed the study from the onset to ensure that all children that were going to be part of the study got the best treatment possible. The Indus Hospital provides free, high-quality care to all patients. It's such a wonderful experience for us to be able to see these children become well and go back home.
One hurdle that any program which hopes to introduce a new vaccine might have to contend with is the fact that vaccination rates in this country have fallen.
You're raising some key points, and these are challenges that the vaccine community in Pakistan and around the world is really struggling with.
The uptake of vaccination in our population leaves a lot to be desired.
I personally asked that mother, why didn't you have your child vaccinated? She said, my mother-in-law or your father-in-law, they don't believe in vaccination.
The oral polio vaccine is a glaring example of how the greater part of the world has become polio-free. And at this moment in time, there are only 4 countries in the world where polio still exists. Pakistan is one of those 4 countries.
And it's really unfortunate, and I think it's a reflection of a number of things. In all fairness, we are geopolitically disadvantaged. We have a country next to us in Afghanistan that has migrant populations that come in and out of Pakistan. And so you could argue that, well, you know, we're never really going to attain universal coverage with the polio vaccine in Pakistan because you have just all these porous borders with Afghanistan in particular. The fact that we are unable in Pakistan to even get routine immunizations out to the majority of our children on time questions, you know, the sense of bringing new vaccines that are even more expensive and sort of falling into the same pit hole of where's all these good vaccines and expensive vaccines going.
In the light of this resistance to vaccines, many pneumonia projects in this country have focused on improving the treatment of pneumonia in hospitals once the disease has already been contracted, rather than preventing it from happening.
We feel that while that is necessary, that it is wiser in the long run for countries like Pakistan to invest in actually preventing the disease from happening in the first place, because we just don't have the resources to treat every episode of pneumonia properly. The focus should now be on vaccines, because that's what really prevents the disease from happening in the first place. Yes, they are expensive, but then we spend millions of dollars on warplanes and other things, and the question is, what is society going to value first? I mean, it's a no-brainer for me. Yeah, of course we would do it, but then there are, you know, bigger decision makers here.